Good afternoon, everybody. Here we are in Lisbon during the EuroEcho Imaging Congress 2017, and I have with me a good friend of mine, Professor Aleksandar Neskovic from Belgrade, Serbia, and is an expert on focus, ultrasound, and I'm going to have a small talk with him about this type of echocardiography. My first question would be, what is the EACVI position on a wider use of echo outside the echo labs and outside the cardiologists' community?
Thank you, Nuno, for this introduction. You know that examination of the heart by ultrasound can provide life-saving information in critical care situations. But ideally, this kind of examination should be done with some practitioner who is experienced and well-trained both in acute cardiac care and in echocardiography. So EACVI recognized for a long time that there is a wide range of different kind of specialists that are involved in the treatment of cardiovascular emergencies, including, for example, emergency care physicians, intensivists, intensive care specialists, anesthesiologists, fellows, even sonographers. So from the ethical point of view, anyone who knows how to do that should do the examination of the heart in clinical emergencies in order to find something that will save patients' life. So there is a growing trend actually to use cardiac ultrasound as a first-line initial image modality in emergency setting, but we notice also that we do not necessarily need the whole data set on cardiac morphology and function, and that we can use restricted information, restricted data in a good way to help our patients. So since introduction on transthoracic echo in the hands of non-cardiologists in the 80s, it has been convincingly shown that relevant information can be obtained by rapid scanning protocol, and the person who do that does not necessarily need to be completely, fully trained in echocardiography. So that is some kind of position of the EACVI.
So can you precisely define what focus is? Yes, and which are the major differences between focus and conventional echocardiography, and also between focus and emergency echocardiography? I think it's important to separate these entities.
So the focus is a point of care ultrasound examination of the heart. It is actually done, it is performed in standardized but restricted protocol as an adjunctive to clinical examinations. So the operator is typically responsible for immediate decisions related to patients and to therapy, and he doesn't need to be necessarily trained in echocardiography, but he has to be trained in focus, and often he used handheld devices, which is more convenient and more widely available. So the first point is that the scope of the focus is different than emergency echocardiography. The scope of the focus is not to fully evaluate morphology and function of the heart, but to rapidly detect limited number of cardiac abnormalities that requiring urgent medical attention. And the second point is that both cardiologists and non-cardiologists can use either focus or emergency or comprehensive echocardiography, depending on their clinical expertise, clinical situations, and the machine used. The crucial difference is the amount of obtained information.
Okay, but an appropriate use, cannot it be dangerous? And the use for someone that is not fully trained?
Yeah, it can be dangerous. I mean, it can be just if somebody is not fully trained, but I would not say that some kind of widespread use of focus is dangerous. I would say quite opposite, because focus used by different specialists saves and will save lives. It is true that focus has some kind of limitations, and there is a risk of missing important abnormalities, also risk of misinterpretation of limited data set, and that's why EACVI recognized that.
Both false positives and false negatives.
Yes, of course. And that's why EACVI recognized it and emphasized in the paper on focus a few years ago, which appeared, the need for specific education and training in focus. We just cannot stop people doing ultrasound, but we can try to learn them, to teach them and to train them to make them better. And at the end of the day, for critically ill who need some kind of urgent diagnostic for life-saving information, it is not important whether that kind of information is obtained by somebody, non-cardiologist doing focus or expert cardiologist doing echocardiography. When that information is available, it should be used in a proper way.
That's what I was going to ask.
Yeah.
You recently shared an important EACVI paper on focus, and I think that in that paper there is an important section on learning, training, and education.
Yeah.
Can you please explain us and summarize what?
So the content and duration of the education and training in focus and echocardiography is quite different by definition. So currently recommendations are done by organizations and societies that already are involved in teaching and training in focus. They are different type of organizations. The question is not whether focus should be used by non-cardiologists, but rather to define standards. And the growing need to set the standards was recognized by the EACVI, their role as a reference echocardiography society, and we felt that we should do that in collaboration with the organizations and societies which are already involved in education and training in focus. So we did it in close collaboration with European Society of Anesthesiology, European Association of Cardiothoracic Anesthesiology, VIM Focus, and Acute Cardiac Care Association. And this document is currently in press and endorsed by all of these organizations. So key principle is to unify framework that should result in competence actually in focus. And the main message is that the requirements for competence are the same for all individuals, irrespective of their specialties, for all of them who intend to use focus in cardiovascular care. So both cardiologists and non-cardiologists, they all should master technique of focus. They all should undergo additional training in basic lung ultrasound, additional training in adult cardiac life support, compliant use of focus, and they all should be very much aware about scope, approach, and the limitation of the focus. So we put it in 3 different parts, like minimal requirements, and these are part of the basic knowledge in cardiovascular disease. One part is also dedicated to pre-recorded cases review, and one part is dedicated to mastering technique with logbook of 50 cases. So course syllabus also is available, or will be available soon on the site.
Yeah. Thank you very much, Sasha.
You're
Professor
welcome.
Neskovic. It was a pleasure to have you here, and I hope you will enjoy the rest of the Congress. Thank you.
Thank you very much.